Hiya, my name's Maia Fergus-O'Grady and I'm one of the company dietitians at Wiltshire Farm Foods. Today I'm going to be answering some frequently asked questions surrounding dysphagia, essentially meaning swallowing difficulties. There is not currently a clear statistic on how many people have dysphagia in the UK. This is because dysphagia is often a secondary condition that results from a primary health concern. However, different pieces of research indicate that approximately 40 to 78% of stroke survivors, 50 to 60% of head and neck cancer survivors, and 27% of those with chronic obstructive pulmonary disease or COPD will have dysphagia. Whilst most cases of dysphagia are the result of a separate primary health concern, it is possible for swallowing difficulties to occur as a result of aging. It is natural for our muscles to reduce in size and lose their strength as we age. This is known as sarcopenia. The swallowing mechanism requires over 30 muscles and nerves, so if any one of these muscles starts to lose its functionality, this can have an impact on the quality of a swallow. There are two main types of dysphagia. The first occurs if you have any mouth or throat issues, which makes moving food from the mouth to the back of the throat to initiate the swallow difficult. This is called oropharyngeal dysphagia. The second type of dysphagia is called esophageal dysphagia, which occurs when there is an issue transporting the food down the food pipe or esophagus towards the stomach. This may be due to an obstruction or challenges with muscle motility. Dysphagia can have various causes, and therefore it's likely to feel different for different people. If someone is coughing or choking when eating, needs to swallow multiple times to get a mouthful of food down, if their eyes are watering, or if they have to clear their throat frequently during a meal, they are displaying some of the physical signs of dysphagia. If you would like to get a feel for the conscious effort required to swallow for those living with dysphagia, you could try and swallow something without using your tongue or without closing your mouth. Do be careful when trying this though. A speech and language therapist, or SLT, will usually conduct a swallow assessment. Here, they will ask you to chew and swallow food and fluids of varying consistencies, checking to see how your mouth, tongue, and throat work to process them. They may also feel around the throat to see if there are any physical abnormalities. You may then be required to have a video fluoroscopy scan, which is essentially a video X-ray. During this assessment, you will again swallow different foods and drinks mixed with a non-toxic liquid that will help the food to show up on the X-rays. These results are then recorded and assessed by your medical team. As dysphagia can be caused by many different conditions, the medical teams that help treat dysphagia can vary. Those with physical injuries or burns may see different specialists to those with cancer. Speech and language therapists, often called SLTs, are key health professionals in managing dysphagia and will likely be part of each specialist medical team. They will assess which IDSI texture level you need and make sure that you're receiving the correct treatment. You may also be referred to a dietitian to ensure that you continue to meet your nutrition and fluid requirements. For those living with dysphagia, there is an increased risk of aspiration. This is where food passes into your windpipe rather than down your food pipe and into the stomach. This can have serious consequences such as chest infections and pneumonia. However, when dysphagia is managed correctly, this risk can be significantly reduced. It's also important to stay well nourished and hydrated, which can sometimes be more difficult when living with swallowing difficulties. You might be more worried than usual at meal times, or be hesitant to bring your meal to the table to eat with others. By blending meal components separately and shaping these using molds, piping bags, or biscuit cutters, you can make your meals look more visually appealing, which may then encourage you to eat more. If you are concerned about your weight or your food intake, you can ask your GP to refer you to a dietitian who can provide you with more specialised advice. Gastroesophageal reflux disease is a condition where someone may experience acid flowing from the stomach back into their food pipe, also known as our esophagus. The stomach acid can cause scarring or narrowing of the esophagus in some cases, which can lead to swallowing becoming more of a challenge. A texture-modified diet may help make mealtimes more comfortable and enjoyable for people living with GORD.